everyone. Welcome to Wesson Women's. I'm Emily, one of the parent educators. Today we're going to take you on a virtual tour of our labor, delivery, and postpartum units. When you first come into the hospital, as you can see behind me, this is our waiting area. One of the first things that you're going to do is you're going to come on over here to the ladies at the registration desks where you're going to sign in, do some initial registration before you go into the Women's Evaluation Treatment Unit. This is the entrance to the Women's Evaluation Treatment Unit where you're going to come first if you think that you're in labor or if something else is going on and you need to be checked by one of the midwives. So follow me. This is the nurses station. And we're going to head over and check out some of the exam rooms where you would come initially into this unit. These are the exam rooms here in We2 where you'll be on the stretcher, get hooked up to some of the machines so we can determine how things look with your contractions, if you are contracting, monitoring the baby's heart rate. You'll also be visited by one of the midwives here in this unit who will do an exam and determine whether or not you are in labor. Any communication that needs to happen will be between the midwife and your provider, and some decisions will also be made about whether you will be admitted or whether or not you need to be observed further, or lastly, if you are discharged because it is determined you are not in labor. Behind me are the Wesson elevators, which you will use when you come into the unit. That will be for your partner and also for any guests that come to see you and the baby. This is the entrance to Wesson 1. All the units are locked and secured, so for anyone who needs to enter the unit, there's a telephone located on the wall, which you would call into the unit. You will need to have the patient's name and room number in order to be allowed into the unit. Once it's determined that you are in labor and you're going to be admitted here to the hospital, you're going to come up to one of the labor units from within a staff elevator like the one behind me. So you'll come directly up into the elevator and you'll be brought onto the unit so that you can go into your labor room. This is one of our labor rooms. So once you are admitted to the hospital in labor from the Women's Evaluation Treatment Unit, you will come upstairs, and this is where you will remain for the remainder of your labor and birth. Behind me, as you can see, this is the labor bed. Not just a place for you to rest, but also it can be put in multiple different positions that might assist you during labor as well as pushing and birth. Behind me also is located the computer screen, which also houses the continuous labor monitoring information, such as tracing your contractions as well as monitoring the baby's heart rate. This is something that can be tracked here within your room, so when your nurse or provider is with you, but it's also something that is remotely connected to our nurses station, and that's also a place where your medical provider can track your contractions and your labor from somewhere outside of this room. What I'm going to do now is just show you a couple of different things that this labor bed can do that might be helpful while you were in labor. So the bed itself can be raised much higher. So if you're someone that would prefer standing during your labor, this can almost come up to table or even countertop height. And this is something that you could lean on as you stand and help gravity to progress your labor along. So for example, you could lean over the bed, use the bed for support, and continue to labor standing upright. This is also an opportunity for your partner to come behind you and provide some comfort measures such as massage or also just applying pressure to your back if you're having any back labor pains. You can also do the same position similarly, but seated, specifically using like a birth ball or a chair. So you could sit on the floor or on a birth ball, on a chair, and lean on the bed that way for support. Another thing that we can do with the bed is we can put it upright and utilize it more as a chair, and that could be helpful also to support you to change positions during labor. So for example, if you wanted to do more of a hands and knees position in labor, we could have you sit in the bed facing the wall with your knees here on the bottom portion of the bed and your upper body leaning upward on this upright part of the bed. So that could be to assist with labor, but also some women prefer to push in that modified hands and knees position. What I want to show you lastly is what happens when it's actually time to start pushing and deliver the baby. Your provider and the nurse will come in and they'll begin to take the bed apart and prepare for pushing. This is what the labor bed looks like after it has been broken down in preparation for the last part of your labor and pushing and delivery of the baby. As you can see, there's places where moms can rest their feet in a modified stirrup type position. These blue areas are also leg rests, so if mom is more comfortable to have her legs resting there, we can adapt the position of this portion of the bed throughout the pushing time of the birth. Also, as you can see here, there's a couple of little openings on either side. This is where we can insert what's called a squatting bar. So that is basically a bar that kind of goes up and over the bed. We put it in place, and that's something that can also be used as a labor tool and also for pushing. That can provide extra support for mom to either hold on to and push, and that can be really helpful as another option for pushing during the birth. If you are interested in utilizing the labor tub during part of your labor, this is a nice opportunity to see what we're talking about. This is something that we could fill up for you and you could utilize as part of your comfort measures during labor. There are a few things that need to be in place in order for you to utilize this tub, so we urge you to talk with your provider to see if it would be an option for your use in your labor. Behind me is the part of the labor room that's more specifically geared to the baby. Directly behind me in this cart is what we call our delivery cart. So what's held in here is all the medical equipment that your provider might need during the labor portion where you're pushing and the baby is actually being born, as well as delivering of the placenta. This over here is what we call our baby warmer, where we can turn on a light up above, and this is an area where we can lay the baby. They're kept nice and warm and toasty, so we can do some initial assessments and examinations. Behind us here we have medical equipment that is utilized specifically for babies. So if your baby requires any type of medical assistance, including oxygen, anything, we've got it all at our fingertips right behind us at the baby warmer station. This is an infant scale. This will also be brought into your room once the baby is born. So after the birth, this will be a time where we can weigh and measure your baby, and you'll be given that information as soon as we know. One of the practices that we highly recommend here at Baystate is for mom and baby to do skin to skin immediately after birth. As long as both mom and baby are stable, we're going to recommend that we put baby directly on mom, skin to skin, with a warm blanket over both. And that's a time for mom and baby to bond. It also helps stabilize baby's body temperature. It also provides stabilization for baby's respiration, heart rate. It can help baby's sugar levels be regulated. So there's so many benefits to skin, and we want moms and babies to be able to take advantage of this wonderful time, and we hope that you're able to do so. This is the entrance to the operating room. If it's determined that you require a cesarean section during your labor, or if you have a scheduled cesarean section, this is where you will come for the procedure. You'll be in this area for approximately 2 hours, the length of the surgery, also with your recovery area in the PACU, where you will be able to spend some time with your baby, feeding, and also bonding. Go ahead. Behind me is one of our nurseries located here on Wesson first floor. Typically, we encourage mothers, babies, and families to room room in together, which means that you keep your baby with you during your stay here in the hospital. However, there are some times when the nursery can be utilized not only for yourselves, but also for any specific type of medical interventions or procedures. So here is a better view of one of the nurseries here on the unit. In front of me you can see this is a circumcision procedure area. So if you do have a baby boy and you decide that you would like to have him circumcised, that would occur here in the nursery during your inpatient stay. That procedure is done by your OB provider. Now we're going to take a look at some of our postpartum rooms. This is one of our postpartum rooms. So this room is set up for postpartum stays. As you can see around the room, there is the bed for mom. We also have the baby's crib set up. There's the restroom for the mother and her support person to use during the stay. And this area is located for medical professionals who are visiting you while you are here. This chair over here does open up to a single bed, which is used for your support person or partner who will be staying with you. There's this whiteboard over on the wall, which we use to share information about your nurse's name, any other medical providers who might be there to assist you and treat you and the baby. It helps give you some places to look so that you can keep track of who has been in to see you and what their names are. As you can see here, this is a crib that babies stay in during the stay here in the hospital. The crib is normally stocked with all the items that the baby would be using here in the hospital, including diapers, t-shirts, receiving blankets, and anytime the baby is moved in the hospital, baby needs to remain in the crib and mom or support person should be pushing the baby around the unit. This is the entrance to Wesson 2, which is typically the unit where moms and babies who've had a cesarean section will stay for the remainder of their postpartum stay. As with our Wesson 1 entrance, as you can see behind me, this is again a locked unit, and you must call in with the mother's name and room number in order to be allowed into the unit. This is a typical room here in Wesson 2. So for mothers who have had a cesarean delivery, this is where you will stay after you have recovered from the surgery. So you come directly upstairs from the recovery area with your baby. As you can see, there are 2 beds here in this room. So mom and baby, obviously, and also space for her support person for the postpartum stay. As in the rooms downstairs, mothers and their partners have a private bathroom to be used during their stay here in the hospital. This is the nursery here on Wesson 2. Typically, moms and babies are going to be utilizing this nursery more than the nursery downstairs, as this unit is typically for post-surgical mothers. So this can be an area where babies are brought for assessments, to check their vitals, and also for any other medical procedures. This is the entrance to our neonatal intensive care unit. If it is determined after the birth that your baby requires specialized medical attention, this is where your baby will be brought. When you come down to visit your baby here, as you can see, there's a welcome window where someone will greet you and give you information as to procedures for going into the unit to see